a yellowish discoloration of the skin, alarmingly high glucose levels, inflammation in the pancreas, recurring pancreatitis, very light stools, very dark urine, abdominal pain, but a very particular pain, stools that float. All these signs and symptoms could indicate pancreatic cancer. Pancreatic cancer is considered one of the most aggressive that exist, and the life expectancy at diagnosis remains to this day quite low. This is due to two factors. The first one does not give symptoms until the disease is very advanced or these symptoms are very subtle. And second, it is a tumor with a great ability to spread throughout the body. The fact that it gives few symptoms at the beginning is worrisome, as it leads to delays in important diagnoses. Something very bad if we take into account what we just said, that it is one of the tumors with the highest mortality. But for this reason, it is super important, I would say crucial, to know very well all the symptoms which I explain in this video. The pancreas is a fairly complex organ. It is a comma-shaped organ which has a head, a body, and a tail. It is an organ located in your abdomen and has very varied functions, from helping you digest to regulating blood sugar. Most malignant pancreatic tumors are located in the head of the pancreas, and this has a lot to say about the symptoms I'm going to tell you about next. Let's start by talking about. You might wonder, Borja, what is the connection between diabetes and pancreatic cancer? Well, it really does have something to do with it. The pancreas can be functionally divided into two parts, the exocrine pancreas and the endocrine pancreas. The exocrine pancreas is responsible for producing enzymes, proteins that aid in digestion. In other words, you eat a steak and your pancreas responds by producing certain enzymes that help digest that steak. And meanwhile, the endocrine pancreas produces hormones that we talk about a lot on this channel, the most well-known being insulin, but also others like glucagon. When there is a tumor that affects the pancreas, the endocrine pancreas, the part responsible for producing hormones like insulin can be compromised. And what does insulin do? Insulin is a hypoglycemic hormone. It lowers blood sugar. And what happens to a person who doesn't produce insulin or produces very little insulin? They have hyperglycemia or very high blood sugar. This is precisely what happens to patients with type 1 diabetes, only that the damage to the pancreas is caused by a very different mechanism. If a person without risk factors, obesity, or insulin resistance suddenly develops severe diabetes at a certain age, abrupt, very aggressive, or one of the causes, fortunately not the most frequent, but one of the causes is this. It can also happen that you were already type 1 or type 2 diabetic and you see a very abrupt worsening of your disease, and not due to another reason. We are going to talk now about a symptom, a sign that draws a lot of attention. It's jaundice. Jaundice is the yellowing of the skin and mucous membranes. It is due to high concentrations of bilirubin, a pigment that we all produce in the blood. But why does bilirubin increase? The liver gets rid of this bilirubin, which is a waste pigment. It eliminates it through bile. Bile is a secretion that is stored in the gallbladder. The gallbladder is located beneath the liver and is very useful for storing bile, which in turn is very useful for digesting fats. From this gallbladder comes a duct called the common bile duct. What is this duct for? Well, it's the duct through which bile is emptied into the small intestine. Where is the problem? The problem is that this duct can sometimes be obstructed when a tumor grows in the head of the pancreas. And therefore, the bile can no longer exit through that duct, and consequently, the bilirubin also cannot exit into the small intestine. The bilirubin must exit somewhere. It can't remain in the body indefinitely. So it goes into the blood vessels, gets reabsorbed, and starts circulating around your body, staying in tissues like the skin and the sclera, giving you that characteristic yellow or orange color. Sometimes it's more intense the higher the concentration of bilirubin. It can also happen that your pancreas becomes inflamed, producing pancreatitis that are increasingly frequent, increasingly recurrent. The pancreas becomes inflamed more and more frequently. Now, the pancreas is an exocrine organ, as we said before, which means it produces enzymes and substances that are released into the digestive tract when you eat and are essential for the digestion of proteins, carbohydrates, fats. These substances, these proteins, are very irritating enzymes. Keep in mind that it has to digest the steak you eat or the fish you eat. Of course, they usually come out through the pancreatic duct, from the pancreas to the digestive tube, and there they act without a problem. But what happens when again a tumor is obstructing this pancreatic duct? Well, what happens is that the enzymes can't get out, and those enzymes start to eat to attack the pancreas itself and inflame it, which is known as chemical pancreatitis. And this in turn leads us to the next symptom, abdominal pain, an abdominal pain that worsens when you eat. When you eat, the pancreas has to work, as I just said, to help you digest the food. So far, so good. But, as we said before, if it can't release its digestive enzymes, they will attack the organ, causing intense abdominal pain every time you eat. That pain is mainly located in the epigastrium, what is known as the pit of the stomach, but it usually moves towards the back in a belt distribution as if hugging your abdomen. In fact, it is called belt pain. It is the pain that also appears in pancreatitis and can be relieved when we shrink by bringing the knees to the chest, which is a gesture that many people who have this problem unconsciously do. You will also be very interested in coluria. What does this mean? Easy, very dark urine. As I mentioned earlier, the yellowish skin color is caused by bilirubin, which cannot pass from the liver to the small intestine for elimination through feces, and instead enters the bloodstream. Once in the blood, it will reach the kidneys and will be filtered with the urine. And this will change the normal coloration of the urine, which is usually yellowish. It can give it a cola color, a cognac color, a very striking color that will not go unnoticed. This color can also appear in other pathologies, for example rhabdomyolysis, but we talk about this in another video. The next problem that this tumor can cause is a rapid weight loss and also a very pronounced weight loss, even reaching a situation of extreme malnutrition called cancerous cachexia. This is because we digest and absorb food worse due to the damage of the exocrine pancreas, so a lot of energy is lost through the feces. Your digestive tract is not able to absorb all the energy you give it with food. It's also because we produce less insulin. For the reason I mentioned, related to diabetes. And when this happens, there is weight loss. It's one of the signs that appear in the diagnosis of diabetes, weight loss. Why? Well, because insulin is an anabolic hormone, and when we don't have insulin, we lose weight. Lastly, the tumor is metabolically active, consuming a significant amount of energy. However, there's more to it. Is there a possible fourth mechanism? There can be a case where the tumor has grown so much that it partially or completely obstructs the digestive tube, causing nausea or even vomiting, which can sometimes be very difficult to stop. And let's go with acholia. What is acholia? What does acholia mean? Well, it means clear or whitish stools. Bilirubin, when it reaches the digestive tube, is transformed into another molecule. This molecule is called urobilinogen, and it gives the typical brown color to the stools, as bilirubin cannot reach the digestive tube for the reasons I previously mentioned. The stools appear without that urobilinogen, without their usual color, being lighter or even totally whitish, which is very noticeable. And we end up also talking about floating stools. Why could stools float in the water? Because it's a sign, interestingly enough, that there's a lot of fat in the stools. Just like oil floats on water, the fats in the stools cause them not to sink to the bottom of the abyss, but to float. Why might there be a lot of fat in your stools? The most common reason is overindulging in fatty foods, such as eating a lot at a buffet or consuming large amounts of fatty meat. Whatever it is that you couldn't fully absorb that fat and it has passed into the stools in an amount greater than normal. But it can also happen that your pancreas does not have the ability to digest that fat because it is affected by cancer. In the pancreas, enzymes such as pancreatic lipase are produced, which helps in the digestion of lipids, fat lipase. It also helps the bile acids that are expelled with the bile, and that can also be affected. That concludes today's crucial yet somber video, everyone. This is a complex subject, but the information could be life-saving. Because, as I said at the beginning, detecting these symptoms in time is difficult. We need to keep them in mind, but it can help to treat the disease more effectively. So, if you're interested, if you've understood the video well, if you like it, then you can share it. Because surely someone somewhere in the world is going to benefit from this information. I really appreciate you being there. See you tomorrow. A big hug and keep empowering.